Hey guys, I'm back. So I got some questions and I'm going to try to answer them. So the first one I got, someone asked me, any chance you could do one on schizophrenia and related disorders? Seems despite doing a bunch of questions, I still keep confusing the timelines, especially with mania and bipolar mood disorder. Also, any insight on peripartum, which seems to be in addition to the postpartum stuff? Great. So there's a couple of questions there, so let's start with the short and the easy one. Peripartum depression is the new name for postpartum depression. And that's because the depression can start before you even give birth. Postpartum depression extends all the way to 1 year after the birth of the child. And the reason postpartum depression is spooky is because it can lead to postpartum psychosis. Postpartum psychosis is the one where mothers end up killing their children. It's very, very scary. We keep a very close eye on women who aren't looking so hot after they give birth. So what is peripartum depression? Well, like I said, it's just depression that happens while you're pregnant. And the DSM-5 is different from the DSM-4. The DSM-4 had very specific definitions about all these things. If you're using an old version of first aid, it might show you that. But here's the thing for the DSM-5. Depression is depression is depression. If someone displays 5 out of 9 of the depression criteria for more than 2 weeks, and one of those is either sadness or apathy, that's anhedonia, they're depressed. Da-da-da-da. If it so happens they're pregnant, we call it peripartum. If it so happens they just given birth, we still call it peripartum because we're around, partum is birth, so we're around that whole area. So that's the deal with peripartum depression. It's just 5 of 9 criteria when they're pregnant or have just given birth. And that's all there is to it. Thank you, DSM-5, for making things easier. Only thing to keep an eye on is postpartum psychosis. This is also to be kept apart from baby blues. Baby blues is just kind of feeling a little bit down. But if you meet 5 out of 9 criteria for more than 2 weeks, ta-da, depression. So don't make it more complicated than it is. Peripartum just means there's a baby. So let's go on to the next one. Let's talk about schizophrenia and related disorders, especially the timeline. So there are 3 names for schizophrenia that are all about the timeline. First let's talk about the criteria for schizophrenia. So first off, and I'm actually reading from a little pocket DSM-5, which I adore. It's fairly similar to the first aid, but it just helps me feel more confident. So they need 2 of the 5 symptoms, and 1 of them has to be positive. So let's see here. So 2 or more of the following, each present for a significant portion of the time during a 1-month period. So this includes delusions. What are delusions? Delusions are the things that we sort of see in the paranoid personality disorders and the schizotypal personality disorders. They believe some weird stuff. Common delusions I've seen someone who believed that they were being turned into a tree by East African witchcraft. They were from East Africa, so, who knows. The other options, there was someone who believed that her neighbors and the city government were conspiring to kick her out of her home. I knew a man who's actually bipolar, and this was a delusion of grandeur. He would intimate to us that he was a member of the Secret Service who was here to protect us from the other dangerous patients. Those are delusions. They're these fixed beliefs that they hold despite all evidence to the contrary, but which otherwise don't necessarily interfere. If they start interfering, that's a better sign that it's schizophrenia. But so it's not responding to internal stimuli, it's just firmly held beliefs that have no real basis. So let's talk about, this is the tricky one. And they can't be culturally acceptable. We don't consider Santa a delusion, we don't consider the Easter Bunny a delusion, we don't consider believing in God, or multiple gods, or whatever. We don't consider those to be delusions because they're commonly held. So there's a little cultural signifier on that one. So what are hallucinations? Hallucinations are most commonly auditory for schizophrenic people. They hear voices. For some people it's many, for some people it's only one. For some people it's a constant low muttering that comments on everything they do. For some people they're mean voices. For some people they're quite nice. And these auditory hallucinations can be continuous. I saw a lot of patients who were very well controlled on their medicines who still said, yeah, the voices are quieter. And that was the best they could really hope for. Visual hallucinations are very rare. If someone has a visual hallucination, it's much more likely that you're dealing with someone with Lewy body dementia, in which case you're going to look for some kind of Parkinsonian symptoms. But yeah, so you're mostly just going to hear about auditory hallucinations. There can be tactile ones, but if you've got someone who's feeling bugs crawling up them, you're more likely to be looking at somebody who has, who's in alcohol withdrawal. They've got formication, the feeling of ants. Okay, disorganized speech. So disorganized speech is interesting because, Rahm Emanuel often will talk about how the police are dealing with the city, but if you look at the sunsets, you'll understand the sun is the one with the power over how the sidewalks form. Now, if you walk on a sidewalk long enough, you'll come to the understanding that we are all very much like cats. Cats are both social and solitary, and if you use that framework, I really think you'll do quite well on your test. So what just happened there, right? I was speaking with normal cadence, but my words made no sense. Disorganized thought doesn't have to be that bad. Sometimes disorganized thought is someone taking forever to eventually come around to the answer, or it's someone who's clearly trying to answer, but the words they say don't make any sense. Whatever it is, the thoughts are disorganized, and conversing with them, you can sometimes feel like it's your fault. Especially, oh gosh, I can't imagine trying to talk to a Spanish schizophrenic patient. I don't speak very good Spanish. Because they sound like they're saying totally normal things. It's only when you really pay attention that you can go, wait a second, this doesn't make any sense. Grossly disorganized or catatonic behavior. So this is one of your negative symptoms, right? We're now in the negative symptoms. Those three were positive symptoms: delusions, hallucinations, and disorganized speech. Things you can actively see about somebody. Disorganized behavior, they're disheveled. They don't brush their teeth, they don't shower, they're poorly groomed. That's disorganized behavior. They hoard, they do all these different things. Not everybody does. And remember, schizophrenia is a really diverse disease. Some people are incredibly high functioning. That's your disorganized behavior, the slovenliness. Then there's also catatonia. Catatonia is very underdiagnosed in hospitals. It's the person who's just not moving. And that's, pardon me, I swear that's not Cheeto dust. It's experimenting with fancy lipstick. No, so this catatonic person sits very still. They don't respond to you. They don't do anything. They have some interesting behaviors. Candle wax rigidity. When you try to move them at first, it's very hard, and then it gets easier. They'll also display they'll mimic you without meaning to. I don't know if you guys have to know the full criteria of catatonic behavior. That's more along the lines of a M3 question. So catatonia is total unresponsiveness. And that's super, super, super strange when you see it the first time. And negative symptoms. So your negative symptoms, like I said, they also include that slovenliness. Total emotionless affect. This can be difficult to tell whether it's actually a problem in some people. Some people are simply very flat when they talk. They don't say much. They answer yes or no. Or if they do talk, it always sounds like this. So that's your flat affect, right? And that's, if they say flat, that means schizophrenic. That's a very specific word. That's like a code word on your history. If you say the person on your physical, if they have a flat affect, that means that they're schizophrenic. You don't really use it in any other context. But let's look at some of these other criteria, right? Okay, so for a significant portion of the time, this is affecting their level of functioning in one or more major areas. So if you've got someone who's got weird beliefs and they're not cleaning themselves and they're hearing voices and it's affecting their work or it's affecting their home life, one of the common vignettes you'll see is the college student who was, never valedictorian, but who now has become withdrawn and suspicious and looks real disheveled. That's your picture of onset of schizophrenia. And so continuous signs of that have to persist for 6 months. So let's take a step back. Let's go back to our college student. How does she get diagnosed? So the first thing that happens is that she goes to, so her friends finally take her to the doctor. How long has it been going on? It's been going on for 3 weeks, and the doctor goes, that's not super great. But it's only been 3 weeks. This could get better. It's brief psychotic disorder. That's a good way to look at these, is look at it in terms of someone who's trying to come to terms with a shitty diagnosis. it's just brief psychotic disorder. Okay, well, what if it lasts more than a month? Well, okay, it's shaped like schizophrenia. It's schizophreniform, but it's not chronic. At 6 months, well, shit, they have schizophrenia. And they don't have to be consistently psychotic for 6 months. And that's in the criteria as well. They can have milder versions of the positive symptoms. They might go back to being just sort of schizotypal, like they just sort of have these whimsical beliefs, but it's not getting in the way of their life. However, they still do have negative symptoms. The flat affect, the disheveledness. That's your story on that. So yeah, I think that's a good look at the schizophrenic conditions. And like I said before, if you also have someone with chronic schizophrenia who also suddenly has gotten depressed, that's schizoaffective disorder. You've now added a mood component on top of an already unhappy person. So that's, and that, if you have a suicidal person with schizophrenia, that's when you go to clozapine. Watch clozapine closely, right? That's the one that causes agranulocytosis. It's the only med that has proven to decrease suicidality in schizophrenic patients. It's an amazing drug, so long as your blood doesn't crap out on you. Okay, I'm actually going to make this a 2-part video, so that's our first part, alright? And I'll see you guys again shortly.